Our guest today is County Commission Chairman of the Board, Mr. Steve Keene. Steve, how are you? And
good morning, Wayne.
Thank you for being with us. This is long overdue. I'm glad you're here.
Well, I appreciate you asking me to come this morning.
We want to get right into it. I wanted to ask you, if you would, Steve, tell us about the commissioners, the board. There's 6 commissioners representing districts and 1 commissioner at large, so it's a total of 7. Tell us a little about the commissioners, who they are. Tell us about them.
Well, we have Ed Cromartie, who was appointed here a month or so ago, and he is representing the Dudley Mount Olive area mainly, and John Bell representing the city of Goldsboro.
Right.
Then we have Ray Mayo, who's vice chair, and his area is up in the northwestern part. Then Bill Pate over in the northeastern part. And then we have Joe Dottery, that's sort of in the Walnut Creek back into the municipality of Goldsboro. And then Bill Pate, who did I mention Bill? Wayne Aycock.
Yeah.
Then Wayne Aycock, he's at our large member.
Okay.
And I have the southern part or southwestern part in the Grantham, Rosewood, Marmac area.
So Wayne County is divided into 6 districts, and then there's one at large that kind of represents all.
Yes,
the
Wayne,
area.
we have around 122,000 in the county, and Wayne represents all of them, and we have about 21 to 22,000 in each district.
You know, I've seen Wayne County grow tremendously over the last few years since I've been paying attention. But, and this is a great thing. We're growing very quickly.
Well, we're growing. In 2000, the census was around 113,000.
All right.
And then if you break it down and look at what we've done in the last 10 years, the census in 2010, yes, we grew around 9,800 people, right. 9,800. But the statistics also break down how we grew. We only grew around 400, a little less than 450 white. And we grew around 840 to 50 African American. But we also brought in into the county 6,500 Hispanics and 1,000 Haitian and Asian. So you have a breakdown of exactly, not the numbers, but who exactly came in, and that affects, of course, your per capita income. You have to look at that. And then you look at schools and education and those children of the workers. So we're
very diversified in our population.
Very. A melting
great.
pot.
That's great. Well, the commissioners met recently in January for a day-long retreat. And you did this to set priorities. Tell us about that process and how it works.
Whenever we were elected in November, we came in right in the middle of a budget year. So we have 2012-13. When we came in the middle, especially with 4 new commissioners, it was important to understand those funds, where they were going, how they were going to be spent in this budget. A lot of them knew coming in by studying the budget, but once getting involved and seeing the dollars that are going to have to be spent in different programs, the monies that are going to be spent in facilities, just not education, but all the facilities that the county owns in those areas, along with health care that is causing such a stir in Raleigh and certainly on the national level. We look at the physical health and particularly mental health. So we're having to look at all health services. So as we look at health services, the facilities, and of course, you know, the sheriff has the interest of the jail. And then we look at all of these in the library in Mount Olive and the bricks and mortar, as I call it. As you look at all of the county properties, you have to, I think, understand as commissioners that we have to set those priorities. And you only have about 5 months before the budget. And all 7 of us were elected at the same time. Right. So we don't come in staggered like municipalities or the Board of Education. All 7 of us come on at the same time. And being elected at the same time with 4 new commissioners, understanding where we're going to go in our budget for the next 5 months, we have to start understanding those dollars.
So Steve, dealing with the budget, as commissioners do, how do you do that? How do you plan it? How do you go through that process?
What we're doing after the election in November, December was a time of transition. Basically, the honeymoon's over.
Yeah.
and in January, we went right out and looked at facilities, and we're working all the facilities. In February, we are looking at the health issues. Mm-hmm. And as we do that in February, we're trying to assess all of the health expenses in the county. And then in March, we're going to look at education. We have a joint meeting with the Board of Education on the 15th. We're going to hear from them exactly what they want in education as far as expenses, their physical plants, their buildings, maintenance needs. We'll be doing that in March. We will get back with them sometime the latter part of March, the first week in April, on the synopsis of what we went through and where we think we can go. And then in April, we're tying it all together. We're looking at the programs that have been submitted to the county to help them along. And then May, we're here. That's less than 90 days away. And March, April, May, and we'll be in the final stages of looking at the big picture of the county, all the funds that are needed for everything at one time. And then we'll vote on that in June, 1st of June, to be implemented June 30, and start our new year July 1. So I think that's the consensus of the board, is to start each month and look at these areas, and we'll be here before you know it, Wayne.
You know, and you made the point that there's 4 new commissioners, 3 were reelected, 4 new commissioners, and there has to be, this is a major responsibility for anyone. It has to be a large learning curve there.
It is a large learning curve, yeah. But we all do understand our fiscal responsibility or fiscal policy of the county, and also the taxing and the expenses that we have to incur through taxing, and certainly the regulations that are set from the state level, and those appropriations that come through the state and through the federal government, and how much we actually have left in the county. Our revalve is important to understand property values, to understanding sales tax receipts.
Well, you know, you made a point about what we have left over. We have a great budget. The problem is that the federal government and state government mandate so much of it that we don't have a whole lot left over as to what people would think we have left over. Am I on track here, or?
When you look at the federal government and you look at almost 80% being entitlements, mm-hmm. and then you look at the debt, you coming down into the state, and you look at the state and how we are physically responsible, the General Assembly and the governor, and you look at that line and you say, well, what is left for the counties? And then what does the counties have to come up? And you have well mandated and unfunded, what they say, unfunded mandates. So as you look at the unfunded mandates, you have to do those, and those are indicators. For example, through your health department and through your DSS. But then you look at how much is left over for those programs that we've established in the county, mm-hmm. and over the years. And those programs are expensive, and they want to grow. And as they grow, they need to be financially sustained. And how do you afford the sustainability? Now you have 3 ways that you look at it as a commissioner. It's like a 3-legged stool, Wayne. You have 3 legs on that stool. One is personal income tax, your per capita income, and then you have your sales tax, mm-hmm. and then you have property tax. And if you knock or upset one of those legs, then your stool falls.
Stool falls.
And we have to be concerned about per capita income for the spending, and then of course the sales tax receipts, and that has a lot to do with our education, school. And then we look at that property tax, yeah. that is so key to not tax any more than we absolutely have to. So we're concerned about those 3 legs, and we have to watch them very closely.
And as you pointed out, population growth, will have an effect on, does have an effect with increased population in the schools, medical needs, the population growing older. You have to approach everything, considering you have to balance everything on that three-legged stool.
When we see a pie and we know that 28 to 32% of that pie is health services, health and human services.
Wow.
In the county, then you have to say, okay, what are the programs that are supporting health and human services? And then we have, like I've said, physical, the mental. We're having areas of your LME now. That's now MCO. Your
All right, what does that mean?
that is
what
your
is an LME?
LME is a limited management entity.
Okay.
With East Point.
Okay.
It's mental health, Medicaid. But it's now a management care organization. So it's actually 12 counties now instead of 4. And Ken Jones, our director of East Point, is doing an outstanding job.
Yes.
But we have providers that are in Wayne County that are doing a great job. But we've gone through a change, and that change has come from Raleigh, indicating how we're supposed to deal with those dollars. So that's just health and human services.
Right.
And then you have, of course, the hospital,
Right.
and you have the emergency room there. Even though it's not ours, it's what they can or can't handle. And then you have the providers that are helping that issue out in the county. So in the rural area,
Right.
and we're still rural.
Indeed, we are. We're still considered, I suppose, an agricultural community,
Absolutely,
and that's a good thing.
it is.
Speaking to the Board of Commissioners, what do you feel is that the people of Wayne County need to know about the commissioners that they may not understand about commissioners? What are the duties of the commissioners, or in other terms, what do you guys do?
Our major responsibility are 3 functions. We must establish the overall physical policy. The physical policy is developing ways to fund the physical plant, the buildings, the bricks and mortar, those, and to at a certain level to have that health and education and safety and all of those. So the responsibility is huge for it. And then of course regulations, setting ordinances and not to be too regulated and with the ordinances. And the third part is just the general administration, making sure that documents are kept and hiring the county manager and having the manager and Lee Smith and going out and managing these policies that we set.
Well, we're almost out of time here, but I could continue for a while, but I have one more question for you. We have always filmed the commissioners' meetings, but now we're actually filming the briefings.
Yes.
And the work sessions and the meetings in an ongoing effort to keep the public informed. Talk a little bit about that, if you will, briefly.
It's all about transparency. It's all about transparency. It's every time we get together in an open meeting that we're filmed, that we use the social media. We use more than just print. We use video. We have invested in that. I'm a visual learner. I can certainly read, but I seem to adhere more to TV visual, and I think that we need to film every time we get together. It needs to be on film. Just like here, we're filming this, and I may make a lot of mistakes on the film, but it is what it is. But we're excited about getting our faces out there for the people. They've elected us. We were not appointed, and we are serving the people, and the people need to know. I think the board is in agreement that we want the 122,000 people out there to see us, to know who we are, and if they've got any. It is in being a commissioner is different than being a state legislature or in D.C. We're seen everywhere: grocery store, drugstore, in churches, doctors' offices. We're everywhere we go. Somebody knows who we are. So we have to represent the county. well. We've got to stay focused and don't get distracted, and I think that's the commissioner's goal, is to show that we are focused and we're ready to go to work. We're doing a lot, and we're excited.
All right.
We're excited about doing that one.
Excellent. Well, we sure appreciate your coming in and speaking with us today. And this is the first of many meetings with County Commission Chair Steve King. And Steve, thank you so much for being with us today. I appreciate
Wayne,
it.
thank you.
Thank you. County Commission Chairman Steve King. I'm Wayne Alley.